ultimate guide to anything Filipino in Las Vegas. This is the Las Vegas Filipino Resource Guide radio show on PHLV Radio.
Good evening, fellow kababayans. This is Sarah Mel Paglinoan, your host for the Las Vegas Filipino Resource Guide on PHLV Radio. For those tuning in, you can catch us live every Thursday at 6 p.m. on Facebook, on YouTube, in the PHLV Radio app. You can also get our podcast on Apple Podcasts, Spotify, or iHeartRadio. Again, it's the holiday season. I wanted to wish you guys another welcome to Christmas, because it's almost December, and I hope you guys are all enjoying the end of your year and, taking the time to spend it with your loved ones. With that being said, today's guest, we are introducing something and someone who is very, very near and dear to me, but also very important in, our lives when it comes to our health. It's something that we don't want to mess around with. It's important for us to pay attention to these, right? But we also get to talk about something a little bit more exciting, the fun side of the medicine world, the medical world, medical aesthetics. And I'm excited to introduce today's special guest, Miss Dr. Arlene Rillo.
Hi.
Doctor.
It's nice to be at your show.
Thank you for joining us.
Thank you for having me.
Yay! You said this isn't your first time, right?
Yes, correct. I did my first interview when I started my primary care clinic.
Oh,
so,
okay.
Yeah.
Okay. So she said primary care clinic.
Yes.
I just want to give a little bit of an introduction. Sorry. So Dr. Rillo, she is dual trained. She finished her obstetrics and gynecology degree, right, in the Philippines, and then she went on to do family medicine residency at the University of Minnesota.
Correct.
And you moved to Las Vegas in
2017.
2017. So she's been here practicing in Las Vegas since 2017.
Yes.
And I want you to kind of introduce your practice a little bit and what it is that you do.
So I am Dr. Arlene Rillo, a kababayan. Yep. So I own VIP Primary Healthcare, which is a primary care clinic. So okay. I take care of 18 years old and above. Oh. We see various insurances. So any new thing coming up, acute care, chronic management, preventive health, I take care. And also it is in the same clinic is where I have my, medical aesthetics, which is the Amalurra Center for Medical Aesthetics. So that's my fun kind of side
venture, right?
Yes.
May I ask who or what inspired you to want to, be in medicine or become a doctor?
I think if you ask that question for all kind of Filipino doctors, we kind of laugh about it because almost all of us would have a maalaala mo kaya kind of sob story, Yeah. So I guess I'm the first in our family. It's always maybe I can remember a past experience where I kind of realized how important it is that somebody knows, medicine, very vital, that can serve as a steward of your family's health.
Yeah.
Be an advocate for your, so it started with that, an advocate of your,
of your health,
a family member's health. And then I am the type of person who always kind of think if I can do this for my family, what about others that don't have a person who can advocate for them? So I want to be that person for them. So it kind of started like that, Wow. And I've always kind of drawn to science and all that. So, so I guess going into medicine is a no-brainer.
No-brainer for you, yeah. Well, that's really, exciting to hear because like you said, people sometimes don't advocate for themselves, right?
Exactly.
And health is not something that we want to, kind of put away to the side. So if somebody can't do it, You
Yeah.
know, what a great person to.
And I guess the advantage of maybe seeing a doctor that's in the same culture.
I was gonna say.
Yeah, I'm. Our clinic is very diverse, very, inclusive. But I'm just saying that part of it, if like our culture, like we're very
hospitable,
very shy, meek.
Yeah.
We came from a culture where people of in position, they respect and they kind of take your word like as really the gospel, so to speak. So it's not, we weren't raised to ask questions, but I know they have a lot of questions and they always say yes even though they don't really like it.
Yeah.
So that's where
true.
I actually train them, like as their primary care provider. When they're going to different specialists, I usually, even though it's not my expertise, I would sometimes write questions for them to ask their specialist. I write it down. So I tell them, I know these are your questions, but I know you don't ask your specialist this question.
Yeah.
So you just maybe, if you're kind of like conscious about speaking in English, you can just give this paper to them and make them answer this question. Don't leave that, room until they answer your questions.
Yeah.
So, in that way.
Wow.
Because I understand
what it's like, to be on that other side, right? Right. It's really nice to hear that you take that extra step as a doctor, because not a lot of doctors do that, and to have you kind of help push the patient and go ahead
because I always think, what if this is my parents?
What if this is your parent or a family member?
Exactly.
Yeah. Wow. And kind of to talk about what the culture thing, like you said, you are diverse in your facility, but there's a little comfort knowing that someone's a fellow Kababayan, that they can go to you, or even like a staff member in your office. If somebody checks in and they see somebody of the same ethnicity, it kind of is a little bit more comforting to them, right?
Yes.
Thank you, doctor. So I want to touch a little bit about VIP primary health care. I've never heard of this before. Are you able to tell us a little bit about it? So when I first moved here, of course, I worked for one of the big companies here as an employed doctor. And then I've always kind of wanted to do things on my own. That's just how I am. I kind of miss the traditional medicine where, there's not a lot of people in between patient and doctor. So that's why I kind of, even though at the time that I opened, it was at a time where it's a scary kind of like, time to open business, but I took the plunge and I've never kind of regretted it, So I chose the name VIP, primary healthcare. A lot of people think I do concierge. Yeah,
because
that's
like
what
concierge,
I was
they have
thinking.
VIP and all that. But the reason why I chose that name is that I wanted to convey to patients or to everybody that they don't have to pay extra money or pay concierge to be treated as a VIP.
As a VIP. Wow. Wow, I love that meaning.
Yes.
It's like you said, putting the patient first.
Yes.
Putting their needs first. And then from there, you kind of transition. You still do that, right? But
Yes.
you also transitioned into Amalurra.
Yes.
Which is your medical aesthetics.
My medical aesthetics.
Yeah. So medical aesthetics, that's kind of including Botox.
Yeah. So
What kind of services?
So Amalurra offers wide range of medical aesthetic procedure.
Okay.
Because the thing is, you have to have the ability to combine treatments.
Oh,
Because
right.
for you to achieve a certain look or a certain goal, you can't use just one treatment. Like, for example, neuromodulator, you can't use that for areas where you want to achieve volumization, know. So you have to be able to know a little bit of, neuromodulators, fillers, doing light therapies, and all that.
So it's a combination of different things.
Mm-hmm.
And I think we kind of talked about this before, but I want you to bring this up again.
Yes.
We talked about medical aesthetics and, how sometimes it gets a bad rep because people are like, oh, it's just all vanity. But
Yeah.
I think I want people to understand that it's not just that.
No, I kind of disagree.
Yeah.
Because if you know there is a feature, you know, just anything in life. If there's
Yes.
something that you're not happy about and you wanna find something to improve it,
Yeah.
you know, why not, right?
Yeah,
So
absolutely.
I actually have a story about one of the benefits that medical aesthetics can give. I have a patient who came in because of severe acne scars.
Okay,
you know?
yes.
Very kind, nice, and brilliant. Person, but because of acne scars, it has wreaked havoc in
Their
his
lives.
confidence. So every
Yeah.
time he goes to interview, he doesn't come across as confident.
Yes,
So
yeah.
we did, I just don't have the picture, but through a series of treatments, we were able to improve acne scars, and
Yeah.
then that was the first time that he attended or he got into an interview, like
He's like-
looking at the interviewers like
Eyes.
chin
Yeah.
up and with confidence in in his talk. So he was able to convey a confident
Self. Yeah.
self,
Yeah. And believe in himself
exactly.
too. Yeah.
So he got the job. So is
Wow.
that vanity?
No, it's
is that
not.
superficial? I don't
No.
think so.
I completely agree. Especially, down the line when we get older, it helps the health of our skin and,
Yes.
our body too. It's not just vanity. That's why, this is something that I want people to see the positive
Yes.
light. And I'm glad I was able to bring you on our show today.
Yes.
So to go off of that, I wanted to ask, do you have any popular or newer services that you're offering?
Yeah, so I kind of like to offer procedures that are biostimulants. So what I mean
Okay.
about that is that it doesn't only give you an acute immediate result,
Okay.
but it also stimulates your innate collagen. And I think, in one of the pictures that, we will show is thread lifting.
Oh, okay.
So
How does that
So
work?
thread lifting is so like this picture you can see to the left is without threads. So this is a 75-year-old female.
Okay.
She doesn't want
Any
invasive
invasive-
surgery. So I offered her we can do threads. So threads that are used in medical aesthetics are medical grade polydioxanol threads.
Okay.
They've been around for quite some time. They are actually the sutures that we use for surgery.
Oh, okay.
Yes, they're dissolvable. Their body absorbs it.
Wow.
But we used it for lifting like sagging skin and tissue. So improves fine lines and wrinkles and deepening of facial grooves.
Right.
But they actually found that this thread stimulates collagen. So
Oh.
so we also use it for stimulation of collagen, so improvement of skin texture. So I can talk about threads forever.
There's more than one benefit.
Yes,
Yeah.
and then I think the other procedure that I've been offering and
Yeah.
I'm in love is the non-surgical nose lift.
Oh, yes, talk about that.
Exactly. So with Asians, so this picture is actually an example of chin and jaw augmentation by use of filler.
Okay.
So, we Asian, we have, rounded,
Rounded
face.
faces,
No
yeah.
matter how much diet we do, sometimes, our face is still kind of rounded because of the popularity of, K-dramas with the
Yeah.
kind of
With their
chiseled,
their
jaw and
jawline.
chin. Yes. So the popularity of this service, the chin and jaw kind of accentuation has, kind of exploded. Yep.
Yeah.
So
And
so,
then you mentioned the thing about noses too. Your nose lift. Yeah.
So this is my good friend, just showing you a side profile of his chin and jaw augmentation.
Wow. So before is on the left.
Yes, before
Okay.
is on the left,
And
and
then
then right. This is
Wow.
just a couple of days. So
And what I love too, if our viewers can see, it's so subtle that it's so natural.
Yes.
It's not like, boom. I mean, if people do want that too, but I just love that for the people who are really interested but don't want too much.
Yeah, or kind of like intimidated that, their face will change.
Yes.
So I did my training in medical aesthetics here in the U.S., but I also have done training in Asia because I am Asian.
Yes.
I cater to a lot of Asian populations, so I want to learn the techniques, how we do it because I kind of like doing treatments that are still kind of like in line with your features. We're just taking you maybe 5 or 10 years back, not really changing how you look.
Right.
So that's kind of how I want to do medical aesthetics, is that it's still you.
But we're just like highlighting or like highlighting it,
or just making you look like you 10 or 5 years ago.
Yeah. Wow, that's so amazing. I love
know.
that. And then I wanted to ask quickly too, the downtime for these procedures, is it very minimal?
It depends on what we're doing.
Okay.
It also depends on, let's say, are you taking any blood thinner? So normally, we make them stop like aspirin when we talk about blood thinner, but still they can be prone to bruising. But it's if you know your anatomy and you can minimize the risk of bruising and swelling. There are just some procedures that you're gonna swell no matter what, but it's not like a big swell. It's kind of expected. I would say it's nothing that you can't you don't have to take off work. Because it's painful. There may be puffiness or swelling, but nothing that will last for more than 1 to 2 weeks.
Oh wow. Yeah. I mean, I would like to plug too. I have my lips done by Dr. Rillo.
Yes.
When we have, like you said, we point out some small things that we just want to kind of improve a little bit, and I've always wanted to even out my lips a little bit more. So it was really awesome experience going in there. I was a little anxious because of needles, but it was actually not that painful, especially as we started going down.
Yeah.
The swelling was only the first few hours, and then the next day, I didn't even bruise.
And then and we used materials with like lidocaine, so to increase comfort, because like nobody wants like needles.
Yeah. It was very, very kind of like spa relaxing, because Dr. Rillo is very comforting, and at the same time she talks you through the whole process, so you understand.
It's very important
what's going on.
To customize a treatment plan, because what's important is what's the patient's needs,
comfort, needs.
And then so you just make suggestion on how to achieve that goal, and then make a customized plan, discuss about pros and cons, how how one treatment will last, downtime, so that it fits their kind of lifestyle.
And what I like also about you is you give your recommendations, right? But then you also kind of let the patient take the lead of what they want, because with my lips I was like, I don't want to do too much, and then she's like, we'll see how we'll do this now, and then maybe down the line you'll want to add a little
very
more.
Conservative. It's always easy to add later rather than commit, and then you end up not liking it. And it puts you off the whole kind of like experience. And then with these patients can always come back, right? And touch up more. So we always call them, maybe the next day to just kind of see how they're doing. They may have questions to kind of answer, is this normal or not normal? So it's very important, because, we kind of talk about medical aesthetics, in a very light and, kind of happy manner, but that is not to downplay complications,
right?
So that's why left and right there's a lot of med spa or medical aesthetics. Sprouting, but you have to do your research, with your injectors, because you're entrusting not only your face but your health too, because you have to know anatomy, where to inject, how to avoid arteries to prevent complications.
And stuff. Wow. Yeah, there's a lot of science behind everything that you're doing.
And like you asked earlier, what's the newest thing that I'm doing at my spa? I kind of briefly mentioned it, that I'm doing the non-surgical nose lift.
Yes,
and I think I have a picture that I can share viewers, right?
Okay.
So with Asians, we already have a cute nose, but a lot of us will still want a little bit of dorsum height and then projection of the nose tip.
Yes.
So to the left is as you can see, she already has a very nice nose,
very cute, yeah.
But she complains about when she wears her glasses, it always
slides
down. So she wants just a little bit of height, right?
Yeah.
So I use a combination of filler and threads for this.
Wow.
And this can last you for about 1 to 2 years, depends on people.
Really?
We metabolize things differently. But there are actually studies, especially in Korea, because this, Korea is actually a pioneer, and this is their, I would say, expertise.
Expertise,
that
yes.
They coined the word hiko nose. So hiko is high, bridge.
Okay.
So studies, show that, even sometimes, threads, can last for 5 years. And like I mentioned, threads stimulates collagen. So, if you put it in the nose, it's not only giving you that, skin, tissue lifting to kind of improve the alar projection or the nose tip, but it also stimulates collagen, So it's also used for anti-aging. And this is something that,
awesome.
that can be done just, within 30 minutes, and then voila, you have a very nice, better profile of your nose.
So it's very quick, 30 minutes. It's not like
30 minutes.
Hour
and a numbing. What takes longer is the numbing. And discussion. And then and marking anatomy. So this is actually a very advanced procedure.
Okay.
If it's done, correctly, you saw the result, but a lot of injector are scared of doing this procedure because it carries, a high complication risk.
Okay. Okay, that's good to know, because as like you said, as lighthearted as it looks, there's also importance of talking about those complications, right?
And we do that. We educate patients that yes, you're looking at the after, but this is also
it's a process.
It's a process. These are some of the things that can happen. So it's informed consent.
Wow, okay. And I do have one quick question, too, because aside from all these, treatments, there's also facials that you do, right? For people who are looking to improve, what is it, skin texture,
color. Yeah, so aside from these procedures, we offer facials.
Okay.
Also light therapy treatments. Like I have a laser called Picasure Pro that is special for skin of color, because we have to be careful with subjecting your skin to light treatments, because you can easily hyperpigment. So the problem that you came in for may be so the hyperpigmentation can be worse than the problem that you came in for.
Okay.
So sometimes that's very hard to kind of, get rid of, or kind of
get under control.
Control, or
Wow.
I do skin or scar revision, whether by laser or a combination of subcision and fillers as well.
Okay.
So
like you said, it's always a combination.
It's
of
a combination
of different things.
a lot of things. So also, this coming year, my goal is for all these procedures to be affordable and accessible, because I know when you talk about medical aesthetics, it's like so expensive.
It is,
you
yeah.
know, because it's true. Because you know the materials, the machines, they're very
They're not cheap.
They're
yeah.
not cheap. You know,
Yeah.
plus the trainings and you know everything that kind of like comes to putting up like a practice of
Right.
medical aesthetics. So,
Right.
but you know, I want to share this. I want a lot of people to experience it.
Yes. Yeah.
So, you know, if you call our clinic, you know, we're coming up with affordable programs
Okay.
and membership that, you know, will really, really, you know, make it like reachable.
Okay.
You know, to be able to
be
do
able
this.
to do it.
Yeah.
If they're
exactly.
interested. Yeah.
Yeah.
Because especially if it's something that they've been, you know, wanting to do.
I know,
And
a
it's
lot
been
of us
holding them
would-
back.
Exactly. You know, if it's not because of you know trepidation that's
Yes.
holding them back.
Yeah.
A lot of times it's more of financial, right?
Yes, absolutely.
So I will try to kind of get that, you know, you know, not the barrier for you to kind of availing those services.
Take care of it. Yes. Yeah. And give yourself that confidence, right?
Confidence
and get into that.
and yeah.
Wow, thank you. And I'm really grateful that you are educating, you know, our viewers on this today, so that way, you know, one, they don't get us scared, but two, they understand everything that goes on behind it.
Yes.
Because I don't want people to just, you know, jump into something and not understand what it is or go,
Exactly.
you know, what the process is like. So do you have any advice for people who want to, you know, do you do consultations? What's your advice for people who are interested?
So first is like calling our clinic.
Okay.
You know, they can call us at 702-342-1384. You
Yes.
know, that's the first step. It's
Okay.
like calling and scheduling an appointment, meeting me, and then so telling me what your needs, what's your concern.
Okay.
And then I can customize a treatment plan for
Wow.
you. And then, and so that's the first step.
Okay. And then you take it from there.
I take it from there.
Yes. Oh my gosh. Do you have any upcoming events or any, you know, anything going on that people can, you know, find you at?
A lot to
I know. There's a lot.
So the December, I'm actually going to be going to the Philippines to do a
okay.
series of training. So I'm always wanting to,
Learn.
you know, learn and, you know, what's the latest
Yeah.
and all that.
Yeah.
But like what it said, call a clinic, you
Okay.
know, we're going to be rolling out like this, brand new year, lots of promotions, lots of, you know,
Specials.
savings and
Okay.
specials. Yes.
Oh, sweet. Okay. And then you are located at...
We're located at 3195 St. Rose Parkway, Suite 212, Henderson, Nevada.
Okay. And that's Amalurra Medical
It's
Center.
Amalurra Center for Medical Aesthetics. And if
Okay.
you're needing a primary care too, VIP Primary Healthcare
Yes.
is also located in that same clinic. So I wanted to make it a one-stop shop.
One-stop shop. That way they don't have to drive everywhere.
Exactly.
Yeah. That's awesome. And they're also on Instagram and Facebook too. You can check out more pictures of, you know,
before and
procedures.
afters
Yes.
and procedures that I do. It's all there.
Okay, awesome. Thank you, Dr. Rillo.
No problem.
Do you want to shout out anybody before we close this out?
So I think my daughter, who's
Yeah, hello.
yes, and my husband, of
Yeah.
course, yeah,
Hello.
and all my staff at VIP and Amalurra.
Amalurra.
They've kind of like work hard this year in making my dream come true. Yeah.
Oh.
And I'm very thankful. So all our kababayans,
Yes.
they have supported me in terms of just kind of like putting my name out there, that there is a new Filipina who's making a name in the U.S. in terms of healthcare and aesthetics.
And aesthetics,
Yep.
yes. Wow, thank you so much, Dr. Rillo. Again, I really, encourage you all to reach out to Dr. Arlene Rillo if you are interested, not just in the medical aesthetics, but also if you need primary health care,
Yes.
help.
And we have very good accessibility. I know.
Okay.
one of the problem for primary is not, being able to get appointments.
Yes.
2-3 months. We can get you in 1 to 2 weeks.
Oh wow, that's really helpful.
Yes.
especially if it, like I said, when it comes to health, you don't want to wait. But I highly recommend you reaching out to Dr. Rillo. She is amazing.
Thank you.
And I will endorse her. No, I'm just kidding. I will recommend her to anybody out there. She's a great doctor, and she's very educated, very smart, and very humble. Might I add. Thank you to all of our viewers for tuning in to the Las Vegas Filipino Resource Guide. Again, we are live Thursdays at 6 p.m. on Facebook and YouTube, in the PHLV radio app, or you can get our podcast, Apple Podcasts, Spotify, and iHeartRadio. This is Sarah Mel signing off. Thank you all for tuning in, and I will see you next week. Happy holidays!